Good afternoon, guys. I hope we're all sparkly. Gym session done. Just about to run the dogs. Let's do a quick vid. What should we talk about today? Let's talk about our favourite topic, sex. I think us men, we're simple creatures with simple needs. The ability to attain and maintain an erection is one of those things we want to be able to achieve. Having a healthy libido, again, something we would like. With low testosterone, those two things can be problematic. Other cardinal presenting symptoms are obviously an element of mental discord, tiredness, and brain fog. But everything affects everything. When you were 16 years old, couldn't get rid of them. Now you're older and the weight of the world has crushed your spirit and you're not as healthy as you once were, it becomes more problematic. So you get diagnosed with low testosterone and you start testosterone replacement therapy. Hey presto, cured. If you've been to the GP, you've likely been offered the little blue pill, Viagra. So what is Viagra? Viagra is a phosphodiesterase 5 inhibitor. What the hell does that mean? Well, what's phosphodiesterase? It's an enzyme involved in inhibiting cyclic guanosine monophosphate that's involved in maintaining integrity and tone within the blood vessel. Do you need to know that? No. But it's there for interest's sake, whatever. So, in essence, Viagra is a vasodilator. And logically that would make sense because it improves erectile function. It improves engorgement of the penis, the corpus cavernosum, say that 3 times real fast. So hopefully you will be able to attain and maintain an erection. Is it a cure? Well, obviously not. It's a short-term fix for the intended purpose of attaining an erection for hopefully intercourse. What we like to do is address causation. We like prevention over cure. Now this little blue pill, when they were investigating its use back in the day, it was actually for ischemic heart disease, again because of its vasodilatory effect, but they found that all these guys got erections. So they thought, right, well, there's clearly a market here for an erection pill. Obvious, really. It's short acting and it is a potential fix, not cure. So they developed Tadalafil. Tadalafil is a long-acting version of Viagra / sildenafil. This has lots of benefits, not just helping to attain and maintain an erection through engorgement of the corpus cavernosum. What else does it do? Well, we know it's a vasodilator. So what else could it potentially help? Well, blood pressure. Blood pressure is complicated, but dilating up your blood vessels makes sense that would help reduce overall blood pressure. It actually helps maintain the endothelial lining of your blood vessel as well. How wonderful is this wonder drug, Tadalafil? What else? As us men age, we tend to get benign prostatic hypertrophy. So it relaxes the smooth muscle around the bladder. Again, wonderful. And actually Tadalafil is now being used as one of the first line drugs for treating symptoms of benign prostatic hypertrophy, so lower urinary tract symptoms, getting up at night time, poor stream, hesitancy, etc., etc. It has lots of uses within medicine. And again, when these drugs get licensed, their mechanism of action is what's important, and we need to adapt what we use them for the intended purpose, but also look to other things. So why do we use Tadalafil in our TRT protocol? Well, as I said before, keep it simple, keep it safe. So you shouldn't really need to use Tadalafil. But we've just said it's more of a preventative drug, and we want to maintain a good healthy cardiovascular system. That's logical, and a good healthy prostate and blood pressure. But actually, the number one reason why we use Tadalafil here at the Men's Health Clinic is it has a mild aromatase inhibitor effect. How fascinating is that? So it will decrease your estradiol compared to testosterone. And as we know, we live in a sick society, whether that be being exposed to endocrine dysregulators or being slightly chunky or having liver problems, we do tend to create an excess conversion of testosterone to estradiol through the aromatase enzyme. So actually, the cardinal reason why we use it at the Men's Health Clinic is it helps modulate estradiol. Hopefully it'll prevent you from needing an aromatase inhibitor. Now again, don't be afraid of using aromatase inhibitors under strict clinical supervision and guidance, because they're under strict clinical supervision and guidance, and it's a needs must. But we quite like Tadalafil because of its other preventative benefits. So how should we use Tadalafil? Well, again, for erections, it's traditionally been prescribed as the weekend drug. 10 milligrams or 20 milligrams, pop one and you're good to go. Well, the Cmax is about 2 hours, and the half-life is between about 18 and 22 hours. So logically, a daily dose would produce pretty much stable levels. So you're not going to go aggressive. So the daily dose is 5 milligrams. Again, it's minimum effective dose. We don't want to prescribe more. We want the minimum effective dose, because anything in excess is harmful. So you're going to reach stable drug levels after about 5 days. And does that mean, hey, presto, all done? Well, as we know, physiology is complicated. So half-lives are half-lives, and then the effect it has on the body. So it brings us nicely on to the potential side effects of Tadalafil. What is it? A vasodilator. So what could potentially go wrong? Well, if you've popped Viagra before, you'll know that there's a lot of facial flushing. Now, is that a problem in itself? No, obviously not. But what's going to happen? This vasodilatory effect, blood pressure. So you have to be well hydrated. As the drug level's getting stable, that physiological effect is having an effect. So please make sure that you're well hydrated at all times. One of the symptoms that we have, or side effects that people complain of, is headache. And again, logically, that is due to relative dehydration. So maintain adequate hydration status at all times. What else is there? Well, yeah, some people complain of nasal congestion. So the sinuses get slightly congested. Again, the vascular component, again, makes sense. Some people complain of gastroesophageal reflux symptoms, acid regurgitation. The lining of your smooth muscle of your gullet, again, causes vasodilation, and there's a sphincter at the bottom, so you can understand that dilation may cause it to regurgitate and cause negative symptoms. What it tends to do is that it actually tends to highlight a problem with your diet. Again, we need to address everything, not just one thing. So the first couple of weeks will sometimes highlight what's actually not optimal outside of not being able to get an erection, not being able to have a good healthy prostate, not cardiovascular system. Everything affects everything. What else is there? Do you ever have to be worried about taking Tadalafil? Well, it's a vasodilator. So what else could be going on? Well, paradoxically, there is an issue with ischemic optic neuropathy. Tends to be a problem in the elderly, not in a healthy population. Taking Tadalafil along with other drugs can sometimes enhance the effect of those drugs and Tadalafil on the body. Again, there shouldn't be a flippancy applied to taking medications. And lots of these medications you can actually get from online sources and not really be under the care of a clinician that will actually act in your best interest, rather than sell you a medication for whatever you want it for. And again, we should always be aspiring to act in your best interest. So Tadalafil, what a wonderful drug. Is there anything else to say? Not really. So the premise behind TRT is to be using the minimum effective dose in the correct manner. Hopefully it's just testosterone cypionate and HCG. If it needs to be more than that, a good go-to drug and a preventative drug is Tadalafil. And again, it should always be under the guidance and supervision of a clinician that will always act in your best interests. Well, better on the dogs, as you can see they're hankering. So nothing else to say apart from go earn your reward.